Hi, I'm Helen Bauer, and this is the Heart of Hospice podcast. The Heart of Hospice podcast is your source for compassionate and informative discussions about hospice and end-of-life care. I'm a certified hospice and palliative care nurse with over 15 years of experience. Whether you're a caregiver, someone with a serious illness, or you simply need to know more about hospice care, this podcast is for you. Join me as we explore all the aspects of hospice, from the details of caregiving to the emotional and spiritual dimensions of end-of-life journeys. For more resources and to connect with me, visit theheartofhospice.com and find us on Facebook, Instagram, and LinkedIn. Keep listening for today's episode.
This is the Whole Care Network. Helping you tell your story one podcast at a time. Content presented in the following podcast is for information purposes only. Views and opinions expressed in this podcast are solely those of the host and guest and may not represent the views and opinions of the Whole Care Network. Always consult with your physician for any medical advice, and always consult with your attorney for any legal advice. And thank you for listening to the Whole Care Network.
This episode is sponsored by Hospice Navigation Services. When you need information about hospice, Hospice Navigation Services can help. Our team of experienced hospice navigators is here to offer one-on-one consulting sessions by phone or video. You can book a complimentary 30-minute session when you need general information, or book a 60-minute session when you have in-depth questions or need to troubleshoot your current hospice care. It's your journey. Hospice Navigation Services can be your guide. Visit theheartofhospice.com to schedule your hospice navigation session today.
In this episode, hospice social worker Lisa Pahl and I are getting back to the basics of hospice, talking about respite care in hospice. Lisa Pahl is a certified advanced palliative hospice social worker. She's the co-creator of the Death Deck and the End of Life Deck, card games that are designed to start those difficult discussions about dying and end of life. You can find Lisa and both the End of Life Deck and the Death Deck at thedeathdeck.com. Our discussion today is all about hospice respite care. Lisa is going to explain the 4 levels of care in hospice, of which respite care is one. We're going to be talking about the limitations on where respite can occur and how long it goes on for, and we're going to give you some details about this. Lisa and I also are discussing the reasons why a caregiver would need to and want to utilize respite, and reasons why a caregiver might not want to use it. Lisa shared with me when respite might not be a great idea, and also how to utilize some micro respite for more frequent breaks for the caregiver. So pull up a chair and listen. I hope you enjoy my conversation with hospice social worker Lisa Pahl. There's a lot to learn. Lisa, welcome back to the podcast. It's great to have you with me again.
Hi, Helen. It's so good to be here.
We are going to have a good conversation, as always, but I'm going to get us started with an icebreaker question. So here is your question for today. What is your absolute favorite topic to discuss with someone who's on hospice care?
Ooh, I love this question. I like to hear from them what some of the family traditions are that they hope will live on. And favorite memories. I love engaging patients in life review. Sometimes the patient themselves might be too sick, but then I talk with the family, the spouse, and that reminiscing about some of the favorite memories and some of their family traditions, and really helping people connect to what's most important in their family, and kind of connecting that feeling of unity and positive feeling. Those are my favorites.
Yeah, that's storytelling. And that runs deep. That's an ancient thing. We've been telling stories, and that's how we've passed down our history, our family tradition, our legacies. That's so cool. That is one of the wonderful benefits of working in end-of-life care and with people that are at end of life, is that you get to hear those stories. And that may not seem like a big deal, but when you do it all the time and you get to hear these really cool things, it really does become pretty special.
Yeah,
I
it
like
does.
that.
And I also really like when a patient is willing to actually talk about the fact that they're dying, and we can have rich conversations about all of their thoughts, feelings, and fears about that. That's kind of the next level conversation that I really appreciate, because I think so often our patients feel really isolated and alone in their thoughts about dying, because often their family doesn't want to talk about it. So if we're able to have that conversation, there's a real profoundness to that, that I hold pretty tender. I leave feeling like purposeful, and like I had really facilitated something important.
Yeah. Do you feel like it's an honor to be able to listen and participate in those conversations with somebody who's dying?
Oh, absolutely. I mean, these are their final days, weeks, months, and they're sharing something so intimate with me. It's definitely an honor.
Yeah. They're giving some of their time that's very limited to us.
Mm-hmm.
And that's pretty remarkable.
Yeah.
Yeah.
Well, our friend Gabby Jimenez is always reminding us to recognize that when people are close to end of life, we really want to be conscientious of their time and not be late and not, get in our own hospice world where you're going from one patient to the next and, it's okay. They'll just be in bed anyway. I can be an hour late.
Oh,
Well,
yeah, they're not going anywhere. So it's okay.
I mean, some people
Yeah.
will kind of feel or say some things like that, but
It's true.
But when you're the person laying in the bed and you have so many they may have been spending all this time trying to prepare for your visit, to take medications at a certain time so they can talk with you.
Right.
There's just so many variables. So, I always appreciate when Gabby puts one of those reminders up on her social media or talks about that topic, because I don't think it's talked about a lot.
Yeah, that's absolutely true. It's extremely disrespectful. And I get what you're saying. They're not going anywhere. This person's bedbound. They're going to stay at the house. But it's so disruptive. And a lot of caregivers have a specific schedule and a routine. And if they're expecting a nurse or a chaplain or a social worker, whoever, at 10 o'clock, and they're not there at 10:15, 10:30, there better be a phone call.
Yeah.
Yes,
exactly.
Absolutely. Oof. That could be a soapbox, and we could talk about that on
I was just going to say, we may have brought
up
up 3 other topics now, but.
Well, so today's topic is a big one. It's respite care for someone who's on hospice. And I think there's a lot of confusion about this, so we want to clear it up for those of you who are caregivers, and maybe even for listeners that are working in end-of-life care, working in hospice. There's a little bit of a regulatory piece, and we're going to dive just a little bit into that to make sure we have that. But there are a lot of psychosocial and caregiving things that are all wrapped up in respite. So I want us to dive into that pretty good. So first of all, let's ask, what is respite care in hospice, and define that? Do you want to take that, or you want me to go with that one?
Sure, I'll take that. So respite care is one of the 4 levels of care in hospice. So we have routine level care, which is basic hospice care. Typically, the person is in their house or facility. Then there's GIP level of care, when there's a higher when symptoms are unmanaged and can't be managed at home, a person might be in a hospital or inpatient hospice under this higher level of care until their symptoms are managed. And then we have continuous care, which is when the symptoms are unmanaged, but we can manage them in the home. And then we have respite care. So respite care is when the caregiver or the family system supporting the patient needs a break or cannot provide care to the hospice patient. Then the person has up to 5 days that they will be placed in a facility, typically nursing home or a hospital or inpatient hospice, for up to 5 days while the family gets a break.
Exactly. So the catalyst for respite care is always the caregiver. It's not about the status of the patient, but all about the caregiver and what the caregiver has going on. So one of the things I want to dive into is you were talking about where it happens. So it's super important for caregivers to understand that respite can't happen in your home. We can't put a hospice worker or part of the team in your home for 5 days to stay with your person. That's not allowed by regulation. So unfortunately, the person has to be placed or cared for in a facility that's Medicare-certified facility. And one of the reasons it's important to talk about that is because the transportation has to happen. And for some of our patients, they can't just be taken in a car. They have to be taken in an ambulance. The expense of that ambulance transport belongs to the hospice agency. The hospice agency pays for that. And that's a big deal because it's a big expense for a lot of caregivers, and they may be concerned about doing respite because they don't want to have that expense. So the cost of the respite stay, the 5 days in the facility, also is paid for by the hospice agency. There's no cost to the family or the patient. And I think that's super important to know. People worry about the cost of things.
I do think that a hospice agency has the authority to charge 5% copay.
Right.
Which would be a very, very small fee. In my experience, the hospice agencies I've worked for have not done that. So again, this is kind of one of these areas where they are allowed to do that. Whether or not your hospice provider would charge that 5%, I think is uncertain. But as you said, the transportation back and forth in the ambulance, which would be far greater. I mean, in the hospice that I work for, it's about $1,100 to go 2 miles. So, it's that's a huge fee. And so that is covered by the hospice agency for sure.
I've had the same experience. So my practice has been limited to Texas, but I've never been in contact with an agency as a consultant or as a nurse where they were charging the 5% copay. I've never seen that happen. So if you're a caregiver and you're interested in respite for your person, that's a really good question to ask them if there is going to be any charge at all for the respite stay. So it can last for up to 5 days. But the beautiful thing about it is it doesn't have to last for the 5 days. It doesn't have to last. And the reason I bring that up is because I remember in my experience when I was working at the bedside, a lot of caregivers are hesitant to use respite care, even if they really need to, for healthcare reasons, or there's a big wedding, or they just need a break from the care. In your experience, what reasons have you seen for caregivers not wanting to use respite?
Typically, the caregivers are afraid of what the care will look like outside of the home.
Yeah.
They may or may not like the facility options that are available for respite. There may be differences in the family's opinion about placing someone outside of the home so that the one person can go to a wedding. There's sometimes some family dynamics or difference in opinion about, whether whether the person should go into a facility for respite or not. There's family differing on those opinions. Um, and I think there's also a lot of guilt. Like, people feel guilty utilizing this option, even though we all know that we can't work 24/7 forever without a break. And
Right.
yet some family caregivers really feel like that is what they're supposed to be doing. But that's why the respite benefit is in place, is so that we don't burn out as caregivers, so that we can continue providing care. Um, I'd say in my experience, the biggest time that people are using respite is when the caregiver really has a medical need, and there's no workaround. Um, like, we've had caregivers who've had a surgery. We've had caregivers who have gotten sick and immediately in the hospital. And then as a social worker, I'm working furiously to try to find some a respite placement for this patient.
Right.
So I would say that when caregivers are forced to use it, they're using it when it's an option because of something fun. I think there's more feelings to kind of process around it, which, I think the social worker and chaplain tend to help them talk that through. But people can visit their family member while they're in respite. There can be other family members going to see mom while she's in the nursing home. So it's not like we're placing someone and then abandoning them or leaving them there. The hospice team continues to come in. Typically the same hospice team, at least in my experience. I know in some geographical areas that might not be feasible, but
Right.
in general, for continuity of care, I think hospices are trying to keep the same team coming in to support the patient in their new surroundings.
Yeah. I've seen it where the hospice team will push up the frequency on the different disciplines, the chaplain and the social worker, just to reassure the family that there is someone coming and going. But the family can come and go and visit. We want to be really clear on that, because it's not like you're just sending mom off and she's there and she doesn't hear or see anybody that she knows for 5 days until she's transported home. I think that's really important for a lot of caregivers to know that there are extra sets of eyes. And I get it, right? Because facilities, especially if you're unfamiliar with the facility that your loved one is going to stay in, it's concerning. And it's not the same quality of care as being at home. It's just different by nature. So I think it's like caregivers don't have enough to deal with, then they feel guilty about taking care of themselves by utilizing respite. And I'd like to say you can just tell a caregiver, oh, you shouldn't feel that way, and that it fixes it. But of course it doesn't, right? We never want to minimize those emotions.
Yeah. Yeah. I mean, it's easy for us to say, don't feel bad. This is okay. But yeah, I mean, there's so many emotions attached to the role of caregiving and the sense of responsibility that someone feels. And sometimes it can feel more anxiety producing to utilize respite than to not.
Sure.
And I do acknowledge that, for some family, what I'll say is most helpful is if the primary caregiver needs a break and there are additional support people who can be visiting and keeping an eye on the patient, so that the primary caregiver isn't then just spending every day all day over at the facility trying to make sure that the needs are met,
Yeah, that kind of voids out the purpose of the respite care. The whole idea is for you to have some time away. Yeah.
So that's what I do. I like that you brought up the idea of the hospice team coming more frequently, and so when I talk to families about respite, we come up with a plan of who's going to visit when, and try to bring in those neighbors and family support, so that there's a hospice person and a personal friend or someone every day of the 5 days. In a dream world, I think that's how it goes most smoothly. So we have the healthcare team looking over things, making sure medically things are okay and needs are being met. And then we have the emotional support of the family system, and that continuity of, we didn't leave you. Norma's just taking a break. She went to her son's wedding. Remember, we're here.
Right.
Those sorts of
Right.
things really can help ease the transition.
We're going to break for just a minute. This isn't the end of the episode. There's more to come, so stay connected.
When you need information about hospice for yourself or someone you care about, Hospice Navigation Services can help you navigate hospice care for the best end-of-life experience possible. If you're walking this journey and need the help of an experienced guide, Hospice Navigation Services is here for you. We understand the importance of having a guide who can provide personalized, unbiased support. Our team of experienced hospice navigators is here to offer one-on-one consulting sessions by phone or video. Whether you need information about how to start hospice services or guidance for your current services, we're here to listen and provide compassionate support every step of the way. You can book a 30-minute free navigation session with an experienced hospice navigator when you need general information to start your hospice experience. Book a 60-minute hospice navigation session when you have in-depth questions about hospice or need to troubleshoot your current hospice care. You deserve compassionate support and guidance for your end-of-life care. It's your journey. Hospice Navigation Services can be your guide. Visit theheartofhospice.com to schedule your hospice navigation session today.
I would say the biggest fear of a caregiver when it comes to utilizing respite is that their person would die while they're in respite.
Mm-hmm.
Yeah, talk about guilt. Wow.
That comes out a lot. In my opinion, unless there's a medical need of the caregiver, I would never recommend sending someone to respite if we see signs of an impending death. It's
Right.
just, it's a setup for some complicated grief.
Absolutely.
And so I do think it's the responsibility of the hospice team to make sure that this is an appropriate time for respite and that we are making sure that, obviously sometimes things happen, conditions change quickly.
Sure.
We can't always predict. But I think in general, most of the time we know if a person's going to die within 5 days or not.
Absolutely. And if somebody is actively dying, we are not going to put them in an ambulance and transport them anywhere.
No.
An ambulance is not a good place to die, period. I'm a firm believer in that. It's just bad. Okay, so let's see what else we want to talk about when it comes to respite. What if the caregiver doesn't want to use the whole 5 days? What if they go in there and the facility looks janky, or they feel like mom's had enough, or they've had all the time away that they want, and they don't want to utilize the whole 5 days? How would that work?
They don't have to utilize the 5 days. They can just inform the hospice team that they don't want to utilize the respite, the full benefit, and then basically the hospice arranges for transport home, make sure that the patient has everything they need at home, and then the facility is paid the amount of time that was used.
Yeah, the three or 4 days, whatever it ends up being. Yeah. So I think that's important for people to know up front. They can say they only want 2 or 3 days, or if they get in there and want to and change their minds, the hospice will arrange for all of that to happen. It's really, it's all for the hospice agency to take care of. There may be some paperwork that the caregiver has to sign to collaborate, to coordinate with the facility. But otherwise, the hospice is responsible for setting everything up.
Right. I'll say, as a social worker who's trying to find respite placement, it can be tricky if the person's only looking for a couple days, because it's a lot of onboarding to admit a patient.
There's a lot of effort that goes into that.
A lot of paperwork, a lot of effort. And so it can be that placement could be found for only a couple days. But in my experience, most of the time we just go with the 5 days and then see how the family feels, and then they can pull out early. But most facilities aren't going to say yes to someone for that amount of paperwork for just 2 days.
Yeah,
So,
that's a good point, because there's a lot of productive hours that go into having your employees help coordinate that. I see
Yeah.
what you're saying.
So this is what we've been talking about, is the respite level of care, inpatient respite. But there are smaller respite visits available through volunteers. And so sometimes it gets confusing for people in how we talk about it, but a lot of what volunteers provide within hospice are breaks for caregivers. Typically, these visits, though, are between like 1 and 4 hours. And so it's not like you could go to a wedding or, that short or that long of a commitment.
Right.
But it is a huge benefit to caregivers. I currently have a caregiver that is the only one caring for her mom, who has Alzheimer's. And we have two volunteers a week in there because they don't have funds to pay for any caregiving support. And she goes to the market one day and then another day she goes and gets her hair done. And so having that consistency and those breaks has dramatically improved how this caregiver is feeling about things she's not needing. It helps tremendously. So utilizing hospice volunteers for these shorter respites, I think, is another way to preserve caregivers' emotional and physical and spiritual well-being.
That's a great point, because it's not the big events where you get away that provide the ongoing self-care. That's important, and it's a great part of self-care for the caregiver, but it's the day-to-day respite, the week-to-week respite, the little, I would call them micro respites, where you get out, you need to go to the grocery store, or you need to go to a doctor's appointment, or maybe you want to go out to lunch with a friend. It doesn't have to be some big health need. A volunteer can come and sit as long as you have an end time, right? It's not supposed to be 6 or 8 hours worth of volunteer time. But so that brings me back to a point that we didn't touch on. How often can somebody utilize those 5 days of respite? And this is there's a vague answer on this.
There is. And the vague answer is there is no hard and fast rule, except for that a maximum of 20% of the person's time on hospice can be spent in respite or a GIP level of care. So technically, once a month would be the max, or somewhere around there. However, it's really the discretion of the hospice team, and it needs to be justified. It needs to be needed. So that's part of our role as the hospice team is documenting well that is needed, because I think there is some regulation on if people are overutilizing the respite benefit, that Medicare may flag that chart or be concerned about the overuse of that benefit. So the thing for consumers to know is, if you feel like you need a break, you talk to the team about it. And some hospices, I think, say want a benefit period is kind of their policy,
Right.
But the Medicare guidelines don't actually say that's.
Yeah, there's nothing specific in there. Yeah, so it's really up to the hospice agency.
Yeah.
And I guess if you find that somebody's requesting respite frequently, you've got a bigger problem in the caregiving system. You've got a caregiver or a caregiving system that's breaking down.
Right.
If they need it that frequently for 5 days at a stretch, then you got a caregiver that needs a different support system. More than what just the hospice team is providing, but to really make sure that the care for the patient is adequate. But yeah, that's where the regulations don't really help us give an answer for that. So the answer is yes, you could use it more frequently. However, it's up to the discretion of the hospice agency to decide how often you can utilize respite.
Yeah.
Yeah, like most regulations, it's there's always some loophole or gray area, so it's good to talk about it. So, Lisa, thanks for getting back to the hospice basics with me today. There's a lot to talk about. How can my listeners connect with you?
You can find me at thedeathdeck.com, or you can email at lisa@thedeathdeck, and we're on all social media at the Death Deck.
Awesome. Well, thank you so much, and I'll see you next time.
Thank you, Helen.
Thanks for listening to the Heart of Hospice podcast. Check out our sponsor in the show notes, and please leave a rating and review on Apple Podcasts. We would appreciate it if you would share this episode with your friends and family and anyone who needs to know more about hospice. Connect with us on Facebook, Instagram, and LinkedIn. And remember, no matter who you are or where you are in your hospice journey, you are the heart of hospice.
This is the Whole Care Network. Helping you tell your story one podcast at a time.